I want to talk to you this morning about a major anti-aging problem, very important to your health and the health of all of your patients, a very big problem that most of you probably are completely unaware of. You've probably never even considered it. Here's the problem conceptually. We were designed for a certain environment. And then we decided that we wanted to move beyond that environment and create a new one. This mismatch between the environment that we were created for and the environment we live in conspires with our native aging program, to create accelerated aging and a serious health threat, a threat so serious that it's probably affecting your health right now and will probably result in early disability and a good chance that it will result in your death. What am I talking about? Well, I'm talking about the deconditioning that occurs with the modern environment. And there's a kind of deconditioning that's going on that I'm going to lead you to the conclusion that it is weakening your heart and your lungs, but the kind of exercise that we do, because we all agree that that should be exercise that fixes that problem, right? But the kind of exercise that we've been recommending can't possibly fix that problem, and in many cases actually accelerates and worsens the problem. The exercise that we advise does not really build functional strength. It won't make your heart stronger, and it won't build your lung capacity. What we have accepted as exercise for your heart and lungs is not effective at combating that problem that I mentioned, that we live in a different environment and that is creating a deconditioning for us that is life-threatening. I don't think anyone actually thought this through from an anti-aging perspective. You would think that if they had, we wouldn't be making these recommendations. And although that may be new to you, by the end of this lecture, you will probably agree. Think about what we do. When we want to strengthen somebody's heart, we tell them to go out and do cardio, right? But what is cardio? Cardio is a shortening of the term cardiovascular endurance training. When we shortened it to cardio, that was probably a mistake because it took the focus off of what we were actually doing with that. What we're doing is we're recommending endurance training. And endurance training is good for certain purposes. But we've made a huge mistake in thinking that that endurance training was all that your heart needed. And worse, that it strengthened your heart. Because you can't build strength and endurance at the same time. It doesn't even make sense. No one would recommend that for a skeletal muscle. If you have a patient that comes to you and tells you that they want bigger muscles, say they want to develop a massive and powerful bicep, would you tell them to curl a half-pound weight 10,000 times for an hour straight? That kind of exercise would be helpful if what you wanted to do was build endurance in that skeletal muscle, right? But we all know it wouldn't create hypertrophy, it wouldn't create power. But what about your heart? It's a muscle too. Does it just need endurance training, or does it need power? This is something I addressed for the first time about 20 years ago now. And I found that there was really hardly anything in the literature. You couldn't even find a discussion of cardio power. What does it take to make your heart stronger? What does it take to make your lungs more powerful? We're going to see what it takes from the research here today. I also have a big beef with aerobics. Aerobic versus anaerobic training also doesn't make good physiological sense in my experience. And weight training, although it creates muscular hypertrophy, is not the best way to create strength that you can use in the real world. But that topic is for a different lecture. Let's start with looking at the research for heart strength. There's a very well done study called the Harvard Alumni study that we use for a lot of the conclusions about heart health. And in it, they divided the participants into those that were doing high-intensity exercise and those that were doing non-vigorous exercise. And they found no relationship between low-intensity exercise and the death rate. In other words, the low-intensity group were getting no increased longevity from their low intensity. The high-intensity group, though, had a significant decrease in all-cause mortality. And you can see from the graph that the higher the intensity, the lower the relative risk of death was. This is going to become more important when we look at the relationship between intensity and duration. That relationship is fairly immutable because you simply can't do high-intensity exercise for very long, which calls into question the recommended therapy that we've used in exercise for the heart, which is always about duration. Intensity versus duration was also studied in recreational runners, and they found that only the high-intensity group had a lowering of blood pressure, a lower triglyceride, a lower cholesterol to HDL ratio, lower BMIs, which was a surprise to the people doing the study, and lower waist, hip, and chest circumferences. The duration had no effect on these parameters. Now here we get more to where I've been involved, looking at how intensity of exercise affects heart function. This study looked at low-intensity training and high-intensity training and compared both of those groups to a control group. And the most interesting thing here is what they used to evaluate the results. And they used high intensity as a percentage of the heart rate at peak exercise, and they used gas exchange to measure that. The high-intensity exercise improved peak O2 uptake during exercise. This is a very useful measure of cardiodynamic fitness. And again, the low-intensity group did not improve it.